Philips Healthcare are delighted to support this event in the Guinness Hop Store today. In Philips we are very much in the space of home healthcare solutions and believe that home healthcare will become the thing of the very near future as people are living into their 80s and 90s and 100s, and they need to be cared for in the home because the hospital system won't be able to support keeping people in that environment. And for older people, they much prefer to be in the home, and Philips Healthcare has a solution to enable them to live comfortably in that environment in a manner befitting them as they move on in later life.
Hi, my name's Fran Hegarty. I'm an engineer from St James's Hospital, and as part of ActivAge I undertook a public engagement process with people in the Liberties. So I set up a conversation with people about the devices that they use to help them live independently. And very interesting things happened as a result of the conversation. The first thing I noticed was that people didn't bring many devices, they brought photographs and artifacts. And what was really important to people was things that held memory and held connection to people. And when we did talk about devices, I found people were using all sorts of technology, but not only things like iPads and computers, also things that we think is very low tech, like washing machines, kettles that light up and that the light goes out when the kettle boils, and they were even hacking objects. They had particular potato peelers with handles that were adapted to them, and there was all sorts of interesting stuff going on. But the more we talked to the people about it and said, are you using technology, they really said they didn't. So we came up with the St James's SICTA law of assisted living devices, which is that a gadget isn't a gadget if it works. So if it works, people don't perceive it as a gadget, and if it doesn't work, they don't like it. And the other thing I did as part of the project was I wanted to challenge engineers and designers. So I made a digital well, which contains images from wells around Ireland, but also contains the voices of the people in the community and the Liberties talking about devices, which might be a touchstone or sort of a guide to engineers and designers when they're designing devices, to remind them to talk to the end users before they proceed.
Well, hello, and my name is John Atwill. I'm the Managing Director of Philips Healthcare in the UK and Ireland, and I'm absolutely delighted to join yourself, Fran, and Jerry and the boys and girls that make up this wonderful gathering. Healthy ageing is something that we in Philips and Philips Healthcare are absolutely passionate about. We believe that there are massive challenges to us as a society in managing the aging population going forward. We want to use technology, and we want to use it in a way that is not threatening in any way to people, but we want to have it embedded in their life to make sure that they are doing what they should do to make that life healthy and prolonged. We're living longer, but if we are not keeping the level of health that is enjoyable for people, then maybe we're not doing the right thing. So that's what we're about. It's great to come here and see such a diverse audience. There's some old folks like me and some even older folks, but there's also a lot of younger guys and girls that are concerned, I would think, about what's going to happen in 20 years' time.
Initiates a discussion on how useful and how maybe not useful emotional robots are in dementia care, where they can build a communication bridge between caregivers, relatives, and people that are in a remote world where we might not be able to get in touch with them.
And the positives that came out of those sort of interactions between the robot and the care?
So it started with me being very skeptical about the whole thing 3 years ago, actually being like, ooh, you can't do that, put a robot into a care home. And then I learned about my own prejudices, about not knowing how it actually works, and also not knowing much about what people really need, which emotional needs they have, and how much they long for being hugged. This is why the whole project overall is called Squeeze Me. It's www.squeezeme.de, and it's a journalistic project combining 5 media types in order to raise awareness on A, the emotional needs of the people themselves, and B, ways that people can actually get closer to them than by brain jogging or other modes.
I suppose a lot of people in there, and I think myself, were kind of a bit confused, because here's something that's meant to be meeting an emotional need, as you've just articulated, and yes, it's a piece of technology, and we see underneath
It's a machine.
It's a machine, and it's very techy.
And then there's a German woman coming from the country of Frankenstein and whoever bringing this robot, the movie on the robot here, which
So
actually
your
comes
prejudice,
from
When you
Japan.
present this, do you find that people also come to it with that prejudice and then are...
Of course they do, because that's what I felt in the beginning. Everybody will think, is it a machine which is going to replace human beings? And it's not easy to understand. It takes its time to understand that it helps building a bridge. It can help. For some people it works, for others it doesn't. But it's not the robots taking over, at least not those ones, not the emotional ones. With the assistive technologies, it might be a different thing. But I also did the documentary in order to, by looking closely at the emotional robot, one might develop a qualified look onto the assistive technologies which are coming next. And Paro is fine as long as you don't use it to measure temperature as well, to take the heartbeat, and to take data and deliver it somewhere else. That's where I'd say definitely you can't do that, combining two things. But as long as it gives joy, as well as a doll or a dog gives joy to some people, I wouldn't say it does harm. And as long as you don't leave people alone with it, as long as it is used in a professional setting and people are looked after by a human being as well as the robot, a lot of relatives and caregivers found it a relief, and it sort of gives a little joy to them as well. Some hate it because of its noise, but others like it. So it's as with many devices. You might get across to somebody with a balloon in the right color or a robot.
My name is Paul Mooney, the company is Hellcoms, and we're here promoting our product, My Home Reach. My Home Reach is a software application that basically helps the older person at home, we call Sarah, keep in touch with her family and friends and carers through a very simple to use one-touch system that opens up communications with her family and friends. The system helps her family and friends communicate with her and manage her home life in terms of medication compliance, her schedule, whether it's a bingo night or a visit from the GP. Also, with the system, she can communicate her wellness out to her friends and family by simply, again, pressing a button to say that she's feeling well today. Additionally, carers coming into the home can write notes, so all those notes are viewable to the family and friends on our network. They can see that she's been up, had her breakfast, the carer has been in and out of the home, and everything is still okay and everything is well at the home. If you're interested in this, you can see our webpage, www.hellcoms.com, or you can contact us at info@hellcoms.com. Thank you.
I've developed this, it's essentially an artwork. I'm just calling it an artificial companion. It was a collaboration between myself and Councillor John Gallagher and people down in Design Core in Carlow IT and Samsung Ireland. So the idea was really to create a device that would then kind of throw up questions about the role of technology in people's lives, like kind of artificial intelligence and those kind of technologies, future technologies, where people, maybe most of their social life would be with a machine, like a robot or a piece of software or whatever.